today, but around noon, we hit about 5 million impressions, and we're very proud of that Power of Rural work. As we begin, I have just a couple of quick housekeeping items for you. First, we want you to know that this session is being recorded, and for that purpose, all the phone lines will be muted or are muted at the present time. We hope that you will have questions and comments and ask you to please click on the circle at the bottom of the screen that looks like a conversation bubble and use the chat box feature. Please chat with all attendees so we can all see your comments and questions. We'll take a few minutes as we have time throughout the session to unmute you and allow for your questions or comments. And then finally, I'd like to let you know that the recording will be available on the NOSORH website by early next week under the Past Webinar Materials tab. So with that, I love the topic that we're addressing today. One of the important aspects of our Power of Rural and National Rural Health Day efforts is our pledge to partner to improve rural health. There are 4 things that we call on rural advocates to do: to communicate, to educate, to collaborate, and innovate. Those activities are really particularly important for networks who are made up of all kinds of rural community-based services and providers. And as I've learned recently, it can be more difficult for networks that are addressing opioid epidemic to do all that collaboration and education and innovation within a rural community, particularly to address the crisis. Today, we focus on networks that are working hard to make health care efficient and effective in rural places and to address the opioid epidemic that is plaguing so many of our rural people. I'm really happy that we're able to share with you the work of the partners of the New York State Office of Rural Health and 2 networks in rural New York that are working to address the opioid crisis. I want to start by just let me introduce Karen Madden to kick us off. Karen is the Executive Director of the Charles D. Cook Office of Rural Health within the New York State Department of Health. She has a broad range of expertise, including statewide rural health policy development, program planning, and network development. She's a past president of the National Organization of State Offices of Rural Health, and I must say that she had a very early vision for National Rural Health Day and has been absolutely instrumental in all of our work on the Power of Rural. Karen, I just want to hand things off to you and thank you for all the work that you do and for introducing us to Rebecca and to Charlotte.
You're very welcome. Thank you, Terrell. We've been fortunate in the New York State Office of Rural Health to implement the Rural Health Network Development Program since 1994. Since that time, the program has grown, and we now have 32 rural health networks located throughout the state. Those networks work collaboratively to develop innovative solutions to their community's healthcare needs and are able to respond quickly when the appropriate funding opportunity becomes available. 4 of our rural health networks and 1 of our critical access hospitals received Rural Communities Opioid Response Program Planning grants this year, and 1 network received a Rural Health Opioid Program grant. The RH provides as much information and data as possible for our stakeholders whenever there is a funding opportunity, and in this case, we notified every one of the NOSORH webinars related to the opioid funding opportunities and provided the most current statewide data to all of our potential applicants. Unfortunately, due to timing, we couldn't include all of our successful grantees in today's webinar, but we are happy to have 2 of them with us today. Rebecca Ivansky is a project manager from the Adirondack Health Institute in the northeastern part of New York, and Charlotte Crawford is the CEO of the Lake Plains Community Care Network in western New York, and they are going to discuss their projects. Many thanks to them for all of their work and for their participation today. So, Rebecca, I will hand it over to you.
Okay, great. Thank you so much, Karen. Good afternoon, and thank you for having Charlotte and I today to share some of the exciting updates on this lovely National Rural Health Day. Joining you today, as Karen said, from AHI. We're here in Glens Falls, New York, and as the project manager on our HRSA Rural Communities Opioid Response Program Planning Initiative, RCORP, as it's been deemed. I'll just give a quick overview for those who may not be familiar with AHI. So AHI, Adirondack Health Institute, is an independent nonprofit organization supporting hospitals, physician practices, behavioral health providers, community-based organizations, patients, and others in our region to transform healthcare and improve population health. So with our roots dating back to the late 80s and the Adirondack Rural Health Network being one of our first programs, we've been watching population health evolve, improve, and strategies for making gains get more and more innovative over the years. I have been with AHI since 2003, so I've been on that journey along with the ARHN program. This also translates, however, to 30 years of experience in building collaborative, successful relationships with our community partners and providers. So first slide, please. So this is just a quick overview. The HRSA RCORP grant is a one-year planning initiative that will bring together a consortium to undertake the planning and capacity building goals and objectives to support treatment for and prevention of substance use disorders, including opioid use disorder in rural counties that are at the highest risk. We're going to do this by leveraging the existing coalition work that's been occurring across the region and by utilizing the multi-sector resources to strengthen the infrastructure and address the focus areas of prevention, treatment, and recovery. So we're all being tasked really with several core activities, and those are going to include achieving collective impact, using data to drive decision-making capabilities, developing a regional blueprint for action, supporting the continued development and, of course, expansion of the substance use disorders workforce, and, of course, plan for sustainability beyond the one-year performance period. I say that, and I think, very quickly, we only have 11 or so months left. So we've really hit the ground running, and we've got some incredible partners lined up. Also highlighted, you'll see that we plan over this year to conduct a needs assessment focusing specifically on gaps in opioid use disorder, all facets of that, to help with the development of that strategic plan of action. And every time I've been sharing that information, I feel like people get very excited at that prospect of having some really specified data. When I think about that and I say these partnerships, the logistics for our region include a territory of 8 rural counties. So it's just over 11,000 miles that encompass the northeast corner of New York State. And our application included 6 strong consortium partners representing prevention, treatment, and recovery. Additionally, we have support from a variety of key stakeholders to ensure that we have local expertise that will help develop this regionally coordinated foundation and comprehensive plan. So how are we going to do it? The consortium, of course, is going to work cooperatively with the partners of our Adirondack Rural Health Network to support the increased education on this epidemic. We really want to better understand and advance those partnerships to enhance our existing services, potentially increase services, and we'll be utilizing, of course, telehealth and mobile treatment models. We will be communicating our success across the region and the state, networking, and continue that eradication of silos by sharing our goals, our data, and that blueprint of best practices. As a multi-stakeholder regional coalition, ARHN informs on planning assessment. It's their expert field, and they, of course, will help support the education and training to further the HRSA RCORP in planning, in addition to the New York State Prevention Agenda and district initiatives. It all aligns so perfectly, it makes sense to really expand on those. So the next slide. So our next slide will show just a quick overview of our planning goals. The alignment among clinical and community services to ensure that our OUD needs of individuals and providers are being met. I read that when we wrote it and thought I would really love to, like we like to say, put ourselves out of a job, right? So if we could ensure that all of the needs of the individuals and providers are met, that would be an incredible task, because the reality of this epidemic is that there's an average of 115 deaths per day. And 80% of the people suffering from addiction to heroin started with a prescription for an opioid pain reliever. So we do need to come together. We need to plan thoughtfully for our approach to treatment to help all different populations. Strategic planning for improved OUD services, expanded provider education, and stronger provider and community relationships. So planning together for new treatment models, innovative approaches that incorporate evidence-based practice with other modalities of recovery options. We got to expand on what we have available for folks, and especially fill those holes across our rural region. Focus on specific prevention plans, which are standardized across the consortium providers or across the region. We're going to look at best practices in prevention. We're going to use data and trends and local service plans to ensure that we can address prevention across that spectrum of needs, and then get measurable data to back that up. And analytical data tool and reporting to perform a gap analysis, develop that sustainability plan, and identify future objectives. So big picture, is having a community needs assessment on the focused subject matter of the impact of substance use disorders that will propel really future potential funding to address and operationalize the plans for making change in our communities. So that, I know, was a great deal of information, and I'll leave it open for questions specific to our project, but it's a really exciting time to be able to bring some dollars to our rural upstate area and continue this fight in the epidemic.
I love your focus on the data and that you're very much driven by that needs assessment and being very strategic and quick. Beth, could you please open the lines in case folks have questions or comments? We'll just do that for a minute or two. And if you're not going to chime in with a question or comment, could you please mute yourself? You can also post something in the chat. Beth, is there anything in the chat?
No, there's nothing in the chat at this time.
Okay. Give you guys another minute or two. Anything you want to hear more about before we move on?
I'd like to know who the members of her consortia are.
Here you go.
Sure,
what
absolutely.
Agency?
So, yeah, absolutely. So our consortium members that are part of our application, we received really a big cross-sector of letters of support. So separating that from the goal of this grant and funding opportunity was to really align with specific consortium members. And we have several coalitions that exist across our region, and like I had spoken to, we really wanted to strengthen those. So we are working with people who are selected as part of those existing coalitions. So it includes Essex County Health Department, Hamilton, Fulton, Montgomery, so HFM Prevention Council, the United Way of the Adirondack Region, which is up in Plattsburgh, Seaway Valley Prevention Council, and St. Joseph's Addiction Treatment and Recovery Center.
Okay, thank you.
Thank you. Thank you, Rebecca.
Sure.
Beth, anything else? I'm sorry, but I heard someone else. Okay. Charlotte, we'll turn the slide over. I'm sorry, go ahead.
There's a question in the chat box that says, will you share your needs assessment tool?
Sure, we can absolutely do that. I can send it along and maybe be included to the group.
Yeah, we can. I was going to say, if it's okay, Terrell, if everyone's all right, we could just post it with the materials to the NOSORH website when we're done.
Yeah, we'll let Rebecca ponder that and share what she can. Great. That's what I love about working in rural health. Okay, Beth, if you could mute the lines again, we'll come back to the chat in a little bit, but I want to give Charlotte time to tell us about what they're doing with their network. Charlotte, and we'll flip to the next slide for you.
Lake Plains Community Care Network, and did you guys hear me okay? Because I'm getting a lot of feedback.
Yes, if the lines could please be muted. Sorry about that, Charlotte.
Oh, that's okay. I'm thinking I thought I did something funny on my end.
You might, if you're on speaker, you might try to use your headset. Yep, it sounds better now, though.
Okay. And we cover 3 counties in western New York since 2000. Anyways, our grant, the primary focus is on reducing the morbidity and mortality in our region by strengthening the organizational infrastructure capacity of multi-sector consortium that addresses prevention, treatment, and recovery at the community and regional levels. The beauty of this one is, and fortunate for us as well, is we are working and involved with an extremely strong opioid task force that's been in existence for a couple years already. So this is actually deeply embedded in that system. We actually that's helping us too. Next slide, please. Okay, so the things that we're hoping the peer recovery coaches, because what we're doing.
I'm sorry, Charlotte. Just a minute. Steph, do you have all the lines muted except for Charlotte? I apologize. Somebody is furiously typing, and I can hear them. So I want to mute everybody but Charlotte for right now. I'm sorry. Charlotte, we're sorry to interrupt your flow and your good story. Just 1 minute.
Yes, everyone should be muted except Charlotte.
Okay.
Thank you.
So, hoping people are familiar with those. We're looking to develop and implement and embed 25. And this is pretty interesting to try to do in 11 months. So the other part of that is the peer supervisors. This is all part of the sustainability as well. If we can grow our own peer recovery coaches with the supervisors that are required, they have to have 500 hours each of supervision before they can actually go on their own. CERPA training is extremely important, especially if an agency is looking to embed or hire a recovery coach too, because then it makes their time that they're spending with their clients billable. Again, helping with sustainability. The biggest sustainability piece we're looking at, and probably going to have trouble, but it can be done, is obtaining 4 train the trainers in our region. So we want to be able to have 4 people that can train new peer recovery coaches as well. This is going to help create sustainability and keep things going and be able to spread it to other people in our region. Big aspect for this is a sustainable professional learning community. What that means is we're looking to develop education for the peer recovery coaches and the supervisors so they stay current with everything that's being done, share best practices, and offer additional learning for them. We are working on a distance education capacity for this so that we can offer it to other regions, so we can network with anybody in New York State once we get up and running with this that have peer recovery coaches. People have great ideas, and we want to be able to share them. And collaboration is key on this entire project. We're going to identify or contract with people to help provide additional education programs, or we can develop internally. Another aspect that I'm beginning to think that after things I've heard and done research on is that there's a huge lack of buprenorphine prescribers, DEA approved. So we're trying to increase that number as well. We're working with emergency rooms because sometimes that's people's entrance into the treatment venue. So we're trying to get them on board, and that is a heavy lift. It's not something that all the providers want to do. The SAMHSA site is very limited on the numbers that they have listed, and it's way outdated. The other thing we're doing with this is working with providers in helping decrease the amount of opioid prescriptions they're writing, or for making their scripts less than what they used to be. So next slide, please. Okay, one of the things is strengthening our consortium. With working with the opioid task force that we have right now, they have 450 members. These are all represented in a multitude of areas. We have healthcare providers, we have departments of health, we have hospitals, we have mental health, behavioral health, we have law enforcement because we work with the jails as well because we're trying to get them to come on board with either offering peer recovery coaches to their inmates so they get connected while they're inside so they follow up with them. We're also getting them to do the MATs as well. So the needs assessment. We're doing needs assessments all over the place with different communities, and you're going to ask me about our forms too. I'd have to look to see if I can get those. We're also going to be doing one with peers as they come out. An interesting thing we've discovered is we have a few new peers, and they are very willing, and this is a very relaxed needs assessment, sat down and said, how are things going? Anything you need help with? Biggest thing, overwhelming, was they wanted to learn more about mental health. So now we're collaborating with the mental health departments in the 3 counties to develop a program to enhance their education, help them grow so they become more comfortable dealing with the mental health population. Frequently have the dual diagnosis anyways. The data tracking we have, again, because the task force has been in existence for a couple years, and Lake Plains as a rural health network has been involved with Narcan education and training for a couple years as well. We were able to pull data on Narcan utilization for our region specifically because we've been able to collect data. That's part of it. But what we've discovered is we're lacking different key components of data. Similar to, like, if someone goes to the hospital and they're treated there, where are they referred to? What kind of, what's the outcome? We don't have any of that. We don't know. And we want them to be able to start using peer recovery coaches so we can start that entrance into recovery as well. We're building the workforce, as it says. We want the 25 peer recovery coaches. We got an RFP out right now for an agency to come on board to do the training for us. And community education and organizational education is going to be key, not only on teaching them the information regarding Narcan and the importance of not utilizing opioids for pain for everything, but it's also going to be education on the peers. We want everyone to know about the peer recovery coaches so that if someone knows someone else who has a problem, they can actually refer them. It's a number we can call right now. Refer them to the peer recovery coaches, and they will come out to them. This is only going to get stronger as we go forward and get more people involved in this. And that's pretty much all I have.
Thank you so much, Charlotte. I know we didn't get to test your sound yesterday, but I appreciate your working through that. Once again, we're going to try to unmute people, or please use the chat feature as well to ask questions of Charlotte or Karen or Rebecca. We'd be happy to have some input on that. Charlotte, I'd like to ask you a little bit about how you find those peers for the training and what kind of peer you're looking for, and how does that work? How's that been for you? Is that a big challenge, or do you find it easy in your community?
Actually, initially it's pretty easy. We've had people come right up and say, we want to do this. And most of the people that are coming up and saying they want to do it are either in active recovery themselves and have been doing well for a few years and see a significant need for this, or they're family members that have experienced it and lived through it. We also have people that are just so impassioned by wanting to do more for this epidemic that they want to come on board and help as well. Right now, we have not had a problem. We have not reached our 25, but we are well on our way because we've only had this grant for 6 weeks. Yeah. So it's really quite interesting. People are very willing to come forward, and the more and more education we're getting out there to the community and other members, because like I said, we have 450 members of the Opioid Task Force, and this is going out to every single one of them. If it goes to an organization, that hits other multitude of other people as well. So, I mean, we have not had any major problem getting people to say, hey, I want to do this.
No. That's fantastic. Are there any questions on the chat, Beth or Matt? Comments, things that people want to know?
None on my end.
Thank you. Next slide, Beth, please. So we wanted to plan very quick sessions for you about this work and to share some resources with you on rural network development and on opioid resources. I so admire our two folks and the new grantees on the opioid projects because they are fast track. But this epidemic does require a fast response, and I think they are right on the bleeding edge of the need for that. A couple of general resources for you both about network and addressing opioid is there is a compilation of resources on opioid projects, lessons learned, training resources that we've collected from some of the opioid reversal grantees of the Federal Office of Rural Health Policy and from other agencies and organizations. So we hope that you will check that out on the NOSORH website, and it's educational resources by topic and opioid. These slides will be posted, so you ought to be able to use the link. We also, as Karen mentioned early on, had a webinar on strategy for writing a successful application. We know that the Federal Office of Rural Health Policy is growing their portfolio of grants and technical assistance to address this work, and so are other agencies across the nation. So there is a little recording and some basic grant writing and other tips for applying for those funds. And then the last thing that I would let you know is there is a Federal Office of Rural Health Policy Network Development Planning Grant open right now. Now, I believe those are usually one-year grants, and as you heard Charlotte mention, one of the keys to their success was having a network and a task force in place. So these planning grants allow for funding, not a great amount of funding, to formalize partnerships, work out how you can collaborate and build effective and efficient networks of care and community organizations. So it would be very quick if you're not already aware of them. It would be very difficult to pull that together by November the 30th, but those opportunities are out there. They come around pretty often, but check those out and maybe reach out to other partners in your community that may be looking at them. They are a wonderful starting point for many projects. So I hope that that is helpful to you, and also, I certainly would be remiss if I did not mention for you to reach out to your state office of rural health. There's one in every state in the nation. They all vary in their capacity and their work around opioids and network development, but certainly if you need any assistance in reaching your state office of rural health, please let us know. Beth, the next slide, please. So as I mentioned earlier, a key component of our work on National Rural Health Day is the pledge to partner. And this is the best way, by taking the pledge, it's the best way that you can stay in touch with us if you want to continue to help us grow your work and to put a spotlight on rural health. Please take that pledge to partner. You'll also see a survey pop up as we're closing out the webinar to give us information about what you would like to know more about and to share information with us about your satisfaction with the webinar and to offer you other resources. Next slide. And finally, as I'm letting you go, I hope that you will really take some time today on National Rural Health Day and read our Community Stars ebook. This is a collection of stories from around the nation. Many are about networks and about the opioid crisis, and the stories are very compelling and are inspiring with all the good work of the people like many of you who are working in rural areas. I want to close by just giving a quick shout out and thank you to Impact Communications team, all their work to spotlight your work. And then just a quick reminder on the next slide, we do have another webinar coming up, a quick one to discuss rural EMS. I'm sure there are strong connections between EMS providers and addressing the opioid crisis and lots of collaboration and work to do there. So we welcome you to join us back at 4 p.m. to talk to Andy Gienap about rural EMS. He's an articulate leader in the state of Wyoming. So once again, happy National Rural Health Day, and thanks for all you do. Thanks, Charlotte and Rebecca and Karen, for everything you do every single day. Bye, everyone.